It's time for the mic drop. I end each show by going deep on one topic affecting our community in hopes we can all learn a little more. As so many impactful things were happening in the news last week, we were remiss in not reminding you that June 16th through the 22nd was National Black Family Cancer Awareness Week. So please accept our apologies for this. Cancer is a cruel scourge, the second leading cause of death in America behind heart disease. So pervasive that I believe it's safe to say there is no one in this country whose life hasn't been touched by it in some way. And you know the saying, when America catches a cold, African Americans get pneumonia. Well, unfortunately, this applies here too. Affirmed by a study published by the American Medical Association in their monthly peer-reviewed medical journal, JAMA Oncology, the study's findings show that while cancer mortality decreased considerably among Black individuals from 1999 to 2019, the cancer mortality rate was higher among Black men and women than in any other racial and ethnic group in 2019. Now, while seeking out a little more knowledge, I did some digging on the National Cancer Institute website and found that for all cancers combined, Black men have the highest rate of new cancer diagnoses, including prostate, lung, and colon. And Black women lead the way in breast cancer deaths. So knowing this, 2 years ago, the FDA established National Black Family Cancer Awareness Week with the purpose of increasing cancer awareness in one of the most vulnerable segments of the U.S. population. Notice that they named it National Black Family Cancer Awareness Week. Now, I wasn't there, but I'm going to assume that the inclusion of that word was deliberate. The risks of a possible cancer diagnosis increase significantly if one has family members who've been diagnosed in the past. So knowing your family medical history is of the utmost importance, giving people an opportunity to know what to look for. And remember, knowing is half the battle. And therein can lie a problem. I've been Black a long time, and traditionally, it's been taboo in the community to talk about medical histories, even amongst family members. You ask and you hear a lot of, hey, you need to stay out my business. Now, thankfully, that's starting to change, but it's still an obstacle to health and wellness that needs to be addressed. We've got to start talking, even if it's a bit uncomfortable. We've also got to start talking to our healthcare providers. We have to advocate for ourselves and our loved ones. If there's something you don't understand, don't leave that office until you do. Understanding is another big part of the battle. And we need to make more healthy choices with our eating, exercising, cutting out smoking, regular checkups. And those are just some of the things that we can control, even though I know they can be hard to, thanks to circumstances sometimes beyond our control. Talking about work, daily living, and environment. That's right, negative environmental factors play a heavy role in the origins of cancer within the body, and systemic racism has had a hand in the community's continued exposure to them, something the JAMA study noted as well, saying greater emphasis should be aimed at understanding the contribution of social inequities to higher cancer mortality rates among Black individuals. Now, I don't think we should be afraid of saying this, not if we're serious about changing the mortality numbers. And I know the medical community hasn't always been honest with the Black community, leading many to distrust doctors and hospitals. Thankfully, that too is seeing the light of day, and transparency and accountability is much more accessible now than it was in the past. As I said, cancer is a cruel scourge on our society, requiring a societal response. Let's hope that the powers that be take the advice of that study to heart.